I think if you think of atherectomy in general, the idea is vessel prep, right? The idea is to try to return a diseased blood vessel, in this case an artery, to a more normal compliance. You obviously never get to 100% of normal, but the idea is to get it closer. You're obviously trying to get luminal gain as well, so that, like Omar was saying, you can achieve really an optimized lumen with really low pressure angioplasty, which then obviously we know from data reduces your chance for dissection, perforation, and just overall stent usage, right? When you think of atherectomy in terms of the four main types, there's obviously, like Omar said, orbital. So that's the classic CSI or Diamondback. Rotational, Jetstream, the rotoblader kind of come to mind. Phoenix is the other one that, classic rotational atherectomy. Obviously there's ablative, which is laser. And then finally there's directional, right? And directional is kind of the Hawk, Silver Hawk, Hawk 1, Turbo Hawk, those types of, brand name devices basically. And, with directional, you can have it, image guided and non-image guided. The Avenger Pantheris is a image guided atherectomy. So that's kind of how I think of atherectomy in terms of big categories and what I'm trying to achieve.
I always have trouble. What's the difference between rotational and orbital?
Yeah. So, orbital obviously think of it as the crown itself is rotating in an orbit, like around a planet. So it's within the vessel rotating in an orbit, versus rotational. Think of it more like a drill bit, right? It's drilling through whatever you're trying to treat. So that's the kind of the way I conceptualize or visualize it,
Yeah.